Hi, I'm Dr. Akshara Arora. I'm a homeopathic physician from Delhi. And today we shall discuss about thalassemia. Thalassemia is an inherited autosomal recessive trait that is of course acquired by the parents. It could be acquired by one single parent or both the parents. Thalassemia is a blood related disorder जिसमें hemoglobin और RBC related changes हमें मिल सकते हैं. Mostly there's a decrease in the RBC and hemoglobin value of a patient. Symptoms of thalassemia include weakness, fatigue, pallor, shortness of breath, malformation in bones, decreased BMI, slow growth, iron or nutrient overload or deficiency, spleen and liver related disorders. Thalassemia is usually of two types, beta thalassemia and alpha thalassemia. The severity of thalassemia depends on the number of gene mutations present in the DNA. If there is a single mutation, the thalassemia could be alpha minora or beta minora. If there is mutation in two genes in the DNA, then it could be alpha moderator thalassemia or beta moderator thalassemia or intermediate thalassemia. If there is three or more mutations in the genes, then the patient is suffering from thalassemia majora or severe thalassemia. Is there a cure possible for thalassemia in homeopathy or any other pathies? No, there is no cure possible for thalassemia, only management is possible. In severe thalassemia, the management includes blood transfusion and iron chelation therapies along with other dietary changes and vitamins and mineral supplements if required according to the patient. For thalassemia minora and moderator, the patient can go for allopathic, Ayurvedic, homeopathic, Unani or naturopathic treatments as well for their management. The investigations we advise to the patient for thalassemia are, first of all, for the screening of thalassemia, we advise the patient the blood test of HB-HPLC. If the result of HB-HPLC comes out as positive for thalassemia trait, then we suggest other blood tests for the patient to test for other complications such as CBC, iron profile, serum ferritin, peripheral smear examination, serum calcium, vitamin D, vitamin B12, vitamin B9 which is folic acid. We could test for hepatitis B, C, HIV infections as well, for LFT, KFT markers with electrolytes, and we can get their ultrasound done. Ultrasound done is usually preferable since thalassemia patients come with complications in spleen and liver. So it makes their quality of life better if we are aware of the entire condition of their body from inside. Now the most important point being, how can homeopathy help a thalassemia patient? Homeopathy helps thalassemia patients wonderfully. A few homeopathic medicines that we can prescribe to a thalassemia patient for their management are cadmium metallicum, calcarea arsenicosa, chininum sulf, calcarea carbonica, calcarea phosphorica, ferrum metallicum, plumbum metallicum, ferrum phosphoricum, manganum aceticum, X-ray, natrum mur, china officinalis, acetylididinum, and for general management, we can prescribe the patient 5-phos remedies, our general tonics like alpha-alpha, avena sativa, or other vitamin and mineral supplements if there is deficiency in their blood tests. Dietary changes are very important to be suggested to a thalassemia patient along with counseling. Counseling, I think, is the most important part of a thalassemia patient's treatment. You have to counsel them to get their parents, their family members, their blood relations tested to see if they are thalassemia positive as well and the severity of thalassemia ongoing in the family tree. As a female thalassemia patient, you can guide them about the complications that may arise during their pregnancy, delivery or postpartum. A number of thalassemia patients come to homeopathy for help, and I hope with our homeopathic medicines, we are able to give them a very good quality of life that they deserve.